What does this and these have in common? Well, kind of cockeyed, you wouldn't think anything unless you're like me, who honestly doesn't have the best teeth out there. And I was having terrible tooth pain in the back of my molars here. Immediately, what's my first go-to? Number one, I was upset because I changed toothpaste and the new toothpaste isn't doing its job. Number two, gotta go to the doggone dentist. Look, I love my dentist. She's great, but I don't want to see her unless it's out in public socially. So I go in, go through everything, look at everything, and guess what? I don't have a cavity. So what the heck's going on? And me not even thinking, that time of year where allergies are out, it's dry, there's a lot of things going on like harvest and things like that. That's what was causing my tooth pain, was sinus pressure brought on by the allergies that led to my tooth pain. Something else that can cause it besides that is sinusitis. If you get a severe case of sinusitis, the inflammation in the sinus cavity can cause increased pressure in your mouth, leading to tooth pain. You don't need to go to the dentist in that case, but you do need to look at some relief in other areas, such as Afrin or the generic thereof. Used to be use it twice a day for about 4 days max. Now, according to the study out of the UK, which is on my earlier TikTok, you can use it longer. Sudafed or Claritin D, Allegra D, Zyrtec D. It can also help reduce the inflammation in the sinuses and take away your tooth pain. Remember, this can cause your blood pressure to go up though. And then, of course, just sinus rinses or neti pots. If you get those sinuses rinsed out, the inflammation can go down on its own as well, and it will help with allergies. So if you're taking good care of your teeth, you've seen your dentist recently, you know that's not what it is. However, you're prone to having allergies, try this out first before you head to the dentist. Now, if it is sinusitis, you may need an antibiotic, but the difference with sinusitis, you will have that extreme pressure in your sinus cavity, but you will also tend to see some blood in nasal discharge or some green mucousy discharge. In that situation, instead of seeing the dentist, see your doctor or provider instead.